Within 1 hour of onset of the symptoms of a stroke, you need to be able to start the treatment, because otherwise the patient loses cognitive skill, loses language. We have found a way to make that financially viable in this emerging region. In the south of Vietnam, in the Mekong Delta, who has set up a center to treat stroke. Ambulance boats, which bring the patients to the center. In the center there is a super streamlined, highly efficient way of imaging the patients super quickly, and you need to make a super fast decision how you need to treat that. So it is about healthcare access. What do we need to do? Whom do we need to team up with? And how do we need to take out costs and complexity in order to really solve these challenges? It's time to use technology to solve the problem. The infectious diseases are much more under control, and now it's about dealing with diseases like cancer, cardiovascular disease, stroke, and how to solve that problem for 8 billion people and not only 3.
Welcome to Meet the Leader. I'm Linda Lucina, and I'm very excited to introduce you to Bernd Montag. He is the CEO of Siemens Healthineers. That is a company that is looking to improve healthcare access for the world's 8 billion people. He's going to talk to us about how they're doing that work, and also about his incredible career that includes time as a theoretical physicist and a professional basketball player. How are you, Bernd?
I'm flattered. No, I'm fine. Just arrived here. Very nice to be here, and thank you for hosting me. Yeah?
Well, thank you for making time for us during a very, very, very busy week. I wanted to get started here. Let's talk about the state of healthcare access. How is the world doing? How would you rate it?
Well, there is potential to improve, because I think we can fairly say that or rightfully say that about half of the world population doesn't have access to healthcare as probably you and I have the privilege to have it, while the technology are basically there. So there is a lot of room for improvement. And in addition, we see that the challenges in the LMICs, if I want to use that word, if you want to use that word, are becoming more and more similar to the challenges in the quote-unquote developed world, and that the so-called non-communicable diseases are now the major cause of death.
And so, given all that, is there a statistic that you find, yourself surprising, or that you think that other people would find very compelling that helps illustrate this problem?
I think, so I give you maybe 3 examples. One is, it's that within the United States, life expectancy, as one example, varies by up to 15 years within one city, depending on where you live. And that is this is like the microcosmos of what we see in the world. Yeah? So it is about healthcare access, and you see how big the difference is. I think the second and third topic I already mentioned. We see that only about half of the world population has that proper access, but we also see that now it's time to use technology to solve the problem, because we can say that more or less the infectious diseases are much more under control, and now it's about dealing with diseases like cancer, cardiovascular disease, stroke, and how to solve that problem for 8 billion people and not only 3.
Mm-hmm. And what is contributing to these issues of healthcare access?
So I think one key topic, and it sounds like an overused term, is really setting up an ecosystem in healthcare. An ecosystem when it comes to you and me, we are used to, here's a reimbursement system, here are healthcare providers, here is an education system, here is a proper funding, here are existing business models, and there is funding, of course, also for the technology. And all these things need to be established in order to make access to healthcare possible. Yeah, it's not only having an affordable machine. It is about having physicians, having a financial models, having all the infrastructure in place. Yeah, so we cannot approach healthcare access with the approach we take in the more developed world, where we can focus on our part of the ecosystem. We have to help building the ecosystem, which is so crucial for access to healthcare.
And what's needed to do that? What's needed for change?
So first of all, I think everybody really needs to contribute in their own area. That means for us challenging the principles of and thinking that innovation is not only about making things better and breaking barriers in, a little bit of an improvement and so on, and trying to differentiate against the other and so on. That and we need to really be proud of innovations which are about making what already exists much more affordable. And much easier to operate and requiring less qualified staff. Plus the whole, as a financial term, TCO around it. But that means this is our core contribution. But on the other hand, we need to team up with those who think of physician education. We cannot wait until they also exist. We need to help bringing the financing. We need to help with awareness campaigns, and we need to work with non-traditional partners like NGOs, to really make a mark and to create momentum.
Sure. So tell us a little bit about how Siemens Healthineers is helping to bridge some of these gaps. First of all, for people who aren't familiar, just tell us more about Siemens Healthineers.
Yeah. So there are multiple ways to look at Siemens Healthineers. One way, which is almost becoming a bit old-fashioned, is we are the IPO'd, now publicly listed and independent arm of Siemens, as Siemens Healthineers, a dedicated company only about providing technology to make healthcare better. We are in the fields of medical imaging, of image-guided therapies and cancer care and lab diagnostics. And we have leading positions in all those. We are a team of 70,000 people generating about 24 billion in revenue. But what is maybe more important in the context of our conversation, every year our systems touch almost 3 billion, to be exact, 2.9 billion patients. Yeah? So that means out of 8 billion, 2.9 billion people get benefit from our technology. And why we are so important is that when it comes to the diseases I mentioned, cancer, cardiovascular disease, stroke, imaging, finding out what exactly the situation is, lab diagnostics, and then precision therapy guided with imaging is so important. Yeah? And we are basically providing that high-tech engine which makes that possible for healthcare providers worldwide.
You guys have a number of really interesting solutions and innovations. I want to talk a little bit about one you have for stroke care, SIS, which is Stroke International Service. Tell us a little bit about that. What is it and what does it do?
Yeah, so this is one of the collaborations I'm really very excited about. Yeah, so this is a collaboration, a long-term collaboration we have with a very visionary and entrepreneurial customer in the south of Vietnam, in the Mekong Delta, who has set up a center to treat stroke. Stroke, by the way, has a higher prevalence in Vietnam than in the rest of the world, out of kind of genetic reasons. And this is an institution which in a role model way deploys together with us technology to really take care of a large population of millions of people, and to build this, again, ecosystem which makes it possible that within the what is called golden hour of stroke, that means within 1 hour of onset of the symptoms of a stroke, you need to be able to start the treatment, because otherwise the patient loses cognitive skill, loses language or whatever. And we have found a way together with this visionary customers to make that financially viable in this emerging region.
And how does the imaging technology work, and then how does the ecosystem function?
I mean, the ecosystem is, this starts with boats, ambulance boats, which bring the patients to the center. And then there is, in the center, there is a super streamlined, highly efficient way of imaging the patients super quickly. Here, the imaging is extremely important, because in stroke, you need to know whether it is a bleeding or is a blocked vessel, and you need to make a decision. You need to make a super fast decision how you need to treat that, and then immediately the patients are brought to an interventional suite where the so-called clot, which is blocking the artery and the blood flow in the brain, is interrupted. So it is really a way of, I don't really like the term, but of industrializing, of process optimizing these steps, so that in a very cost efficient but in a very fast way, patients can be treated and hundreds of lives are saved basically on a daily basis.
And so basically you guys partner with Stroke International Services, and then that sort of helps connect people to a hospital where there's special training, and then also they get sort of extra access to special digitally enabled services and the like. What else is helpful to know about that program?
I mean, it's for me one of the showcases, but one of the examples of what needs to get done. We are working in similar settings. We work with the NGO City Cancer Challenge, which is about how to improve cancer care in a city by deploying, on the one hand, all of our technologies of starting with making mammography available for women in a city, but making also clear that how treatments can be done quickly in a cost-efficient way. We are helping to train the physicians. We have other programs where we use, together with the Global Fund, X-ray systems with built-in AI to diagnose tuberculosis in areas of emerging countries in which there are no radiologists who are able to read the images. So it's always this question of what is the disease burden, whether it's cancer in Cali, Colombia, or whether it is stroke in the Mekong Delta, or whether it is tuberculosis in countries like Indonesia, and then to work our way backwards. What do we need to do? Whom do we need to team up with? And how do we need to take out costs and complexity in order to really solve these challenges?
And you mentioned with the Stroke International Service that you've increased access to care for strokes. Is there any data or information yet on maybe the reduced incidence of sort of negative outcomes and things like that? What is there a before and after that we can kind of see with how people are faring?
I mean, I don't have a very clear, number before after, because it's always sometimes also not so easy in cases like this to look at the before. But I mean, when you look at the after, when you look at that this center is now visited by leading neurologists worldwide, because they are so impressed by the number of cases, and by the outcomes, and by the not only survival rates of the patients, but the survival without any remaining handicap. It shows that there are no compromises made, but that we really have achieved a breakthrough.
You mentioned AI. What's important to consider in embracing AI to improve healthcare access?
See, the challenge very often in healthcare access is not only the need for capital to set up the technology, and sometimes this is the easier challenge to overcome. The other topic is you need specialized physicians in order to do the diagnosis, or in order to make the treatment decision, or in order even to perform the treatment, cancer care with radiation therapy or whatever. And it is very often turns out to be very hard to bring physicians into the tier 3 cities of whether it is India or an island in as part of Indonesia or wherever, yeah. Because typically, I mean, physicians are trained in the big cities. They get offers to work in Calcutta, Mumbai, Bangalore, or in Jakarta, and so on and so on, and going back into a kind of a tier 3 city and so on is not very attractive, and I don't want to blame them, yeah, but it's just a reality, yeah, that so the idea of how to make sure that there's not only technology, which is crucial, yeah, because without technology you cannot diagnose cancer, or you cannot treat cancer or cardiac diseases. AI can help to take over tasks normally physicians would have done, yeah, so the routine tasks, and then you can augment that with providing virtual care and digital solutions, yeah. So AI and digitalization are key in overcoming the access challenges.
Amazing. I mentioned earlier that you were trained as a theoretical physicist. What drew you to that?
That's a good point, a good question. And I have a story before and a story after I did this. So, I mean, I kind of, it kind of happened to me, but I really fell in love with theoretical physics. And I think the reason is, and this is where I see, by the way, the analogy between being a CEO and being a theoretical physicist. In theoretical physics, the beauty is, that you see all the many things, the complexity of the planet. But in the end, I find it super fascinating how simple and beautiful the formulas are, yeah, and the basic principles of theoretical physics are. And to some extent, I believe that part of the role of a CEO is also to, on the one hand, see a little bit the pattern in the complexity, in the noise, to simplify without being oversimplifying. And it's also really important to communicate to others in terms which are simple, and not because others are not sophisticated, but I think one needs simple and convincing pictures to align organizations, yeah, and to paint a picture which brings 70,000 bright minds together, yeah, and to also talk with customers, talk with other stakeholders, yeah. So from that point of view, I think this is something I kind of like, yeah. That's maybe in hindsight also why I like theoretical physics, yeah.
And you also had a turn as a professional basketball player. Our viewers and our listeners didn't catch when Bernd walked in, but he's quite tall. I am quite short, and so it was quite comical when he did. Can you tell us about that time when you were there, but also how it changed you as a member of a team?
So, I really loved being a basketball player. And I think what I really like, the aspects of it, I think it's on the one hand, what I like is this idea of constant, this is more the individual aspect, the topic of constant improvement, So, I mean, I hope I don't come across as an overachiever, but the idea, I think this is what, I don't play golf, but what, I think what people like in golf is, how do I always get better, or also what people who do ballet or people who play a musical instrument, it's about, how do I improve? So this is one topic I find that fascinating, and I think it's a lifelong process for all of us. I think the other topic, which it potentially sounds like a platitude, but I find this really important. You learn how great it is to work in a team, because in a sports team, whether it's basketball or soccer or whatever, everybody comes with a very individual strength. I mean, in basketball, there are 5 players on the court, and they have very different roles. They cannot exist without each other. And then how to align this individual strength and the individual whatever mood, and whether it's a good day or a bad day, and to then have that overarching purpose together. I find this is a fascinating topic, and I think it's not by accident, that everybody loves to watch sports movies, and why sports teams are often used as analogies for successful organizations.
If you hadn't had that time in basketball, how would you be different as a leader? Like, is there something you do now that you just never would have considered had you not had that experience?
Yeah, so this is a very theoretical, okay, so it's a question to the theoretical physicist, because it's a long time ago. But I believe, there's, I start with the individual topic. I think individually what sports teaches you is, and now I sound really, really like a stereotype, it teaches you discipline. You learn. You lose games. You screw up, and then to go back and have a shot at it again. I think there is a certain endurance, or always showing up at practice, and so on, and I think this is something which is a good thing. I don't know whether I would be different without it, but I think it's a really, really good thing. The other thing is really this team aspect, of and learning, or having learned early, how rewarding it is, and how much more rewarding it is to win as a team, or as a part of a team, instead of winning alone, or being, So it's funny, in the best moments I have in Siemens Healthineers, then it's when I feel reminded to the time when we won a game or so.
What made you transition into healthcare, into medicine?
So again, I was a bit lucky. And in hindsight, it all, to me, it sounds super logical, because the combination of theoretical physics and basketball has prepared me ideally. But it's my narrative of the two things. Theoretical physics, as this is what helps me, connect dots and coming up with themes and proposing them to our stakeholders, to our team. Basketball is more the topic of, on the one hand, the endurance piece, but then the team aspect. I more or less happened to step into healthcare. And I was super lucky, because my first job was in the company I now have the privilege to be the CEO of. So you can say Bernd has the most boring career, has never seen something else, or you can say Bernd has a super rewarding career, because it's great to grow, to start, and then I really got addicted to what we are doing here.
You've been there since '95?
Yes.
Yes. And in that time, you said that it's all about learning and always improving. What are you improving now? What's got your attention?
So in I think probably every football team and everybody needs to do the basic blocking and tackling. Yeah. So I mean, you are never done, and everybody needs to do the basics and so on. So take this. So I don't want to talk about only the super big things. I think that the biggest something where we are pretty strong, but I want to get even better, is really helping to address the big challenges of healthcare. And that is, I mean, as I mentioned, I hope I didn't mention too often, managing the non-communicable diseases, in an environment where especially staff is a scarce resource. There is staff shortage. There is the health equity and access to care challenge, and there is a cost challenge. Yeah. So, and I think the huge homework we have as Siemens Healthineers, but also a huge opportunity, is how do we step by step becoming even better and even more relevant player for those who deliver care in a given region, so that they really feel, these are the guys who hands down have super exciting products and do great service, but I can also discuss the big picture with them. Yeah, and this is something we are. I mean, currently we are, for example, having a long-term partnerships with entire provinces of Canada to improve patient cancer care. Yeah, and why these are landmark agreements for us is because it's now not only the individual transaction, the individual topic where one physician is super excited about the tools we deliver, but it is about how do we work with them who make a difference for many, whether it is the CEOs of big health systems or whether it is NGOs for whom we have a lot of respect, or whether it is provincial governments.
That, unfortunately, Bernd, is all the time that we have with you. I could have talked to you for far longer, but thank you very much for coming today.
Thank you for having me.
Thank you very much, Bernd. For our viewers who would like to check out more video podcasts, go to YouTube at the World Economic Forum's channel, and you can also check out our transcripts at wef.ch/podcasts.